Mr. Gates, thank you so much for speaking to The National.
Great to talk to you.
You've just launched your goalkeepers report, and your note was important. We can't stop at almost. And so this comes at a moment when global development aid, overseas development aid, has dropped. The OECD says something between 9 to 17% in 2025, and the numbers are worrying at a time when actually a lot of progress has been made. So I want to ask you, who will heed the call? How can we make sure we don't stop at almost when it comes to eradicating diseases like malaria, polio?
Well, the good news is that for 25 years, the rich countries were quite generous. And that led to a miracle, which is that childhood deaths, kids under 5, went from around 10 million to under 5 million. And that's the fastest pace of reducing those deaths ever in history. And so people should understand that money was extremely well spent. The number of mothers who have living children who are going to contribute to their countries is quite phenomenal. That when that money is cut, of course, we get less bed nets, less vaccines, less care for pregnant women. And that's why deaths have gone up from 4.6 million last year to 4.8 million this year. And so my plea to all the rich countries is that they prioritize this work. For most countries, it's well less than 1% of their budget. A few like Sweden and Norway and actually the UAE are a bit above that, so very generous. The UAE is continuing to be a generous donor, which is absolutely fantastic. So we know, how to save lives, and I believe we will get the aid donations back. And those will be even more impactful because we have a lot of innovative new tools, new vaccines, ways of protecting women from HIV, ways of giving women good nutrition, stopping women bleeding from death. It's incredible. The tools pipeline is very, very good news, and that's what this money gets spent on.
You mentioned the UAE, and you have a partnership with the UAE. You have a friendship with Sheikh Mohammed bin Zayed, the president of the UAE, and of course now the foundation, the Mohammed bin Zayed Foundation for Humanity. Tell us more about this relationship and also how you see particular focus on innovations and also the polio eradication and malaria eradication that you're working on together.
We've had a great partnership with the UAE going back about 20 years now, and that's included a mutual commitment on polio eradication. We have a big announcement on that tomorrow. And we've worked together on neglected diseases, reaching the last mile fund. We've worked on the Beginnings Fund, which is helping get these new tools to save mothers and children's lives. And so it's fantastic that the UAE has a lot of key relationships, whether it's in Africa or Afghanistan and Pakistan. And so together we've been able to achieve an amazing amount.
Resources are important, but as you said, innovations are also important, and the partnerships. In your prioritization, especially as you put out this call for 2026, what are you going to be focusing on? What's going to help us reach the last mile, so to speak?
Well, the killers of children, fortunately, there aren't that many. If a child is well-nourished, if their first 30 days they're well taken care of, if we avoid lots of pneumonia, diarrhea, or malaria, then the child not only survives, but also they fully develop their brain and their body. And the dream here is that over the 20 years, which is when all my money will be spent, that even these poor countries can be lifted up because their children will be healthy. They'll be able to be well educated. In these countries, over that time frame, almost all of them can become self-sufficient. We saw this in Asia with India, Indonesia, and Vietnam, that they received a lot of support from these various health funds, and now they're completely self-sufficient. The African countries are far poorer. Pakistan, Bangladesh still need a lot of help. But this is the 20-year period where we should have almost no countries that aren't prosperous because of these incredible health investments that we're making.
Now, we have to talk about USAID closing because a lot of countries in our part of the world, in the Arab world, but of course also in Africa and beyond, were affected. Do you think USAID will ever come back in a different format? And is the US's retreat having most of these consequences? I mean, it has a leadership position that then, of course, knocks on for others.
Yeah, so the US has been very generous on health things. And briefly at the start of this year, that was entirely cut off and about 10,000 people were let go. In my view, that was done without warning. It was a mistake. And now we're in a dialogue with President Trump and the Congress about, okay, what level of funding will be resumed. I'm hopeful that it'll be a very modest cut, like 10%, but it could be as much as 40%. And so that dialogue will be very, very important. They won't go back and hire the same level of people. They might go back to, say, 1,000 people. And that means that we have to use local partners more. And in countries that have reasonably good primary health care systems, that works well. Ethiopia, for example, has really invested in their primary health care system. In countries like Somalia that are tougher, we'll have to work with NGOs, including religious NGOs, which the U.S. puts a priority on that. So I'm pretty hopeful about the U.S. situation, even though it's still up in the air.
That point about the type of coalitions you have, so in countries where you can work directly with governments, with others, with NGOs, and as you mentioned, the UAE has incredible ties with some of these countries. So how important is it having a partner like the UAE, for example, develop a relationship in Ethiopia, in other African countries? How helpful has that been to your work?
Yeah, so the UAE is pretty amazing in terms of the relationships they have. And so the partnership combines that sophistication together with our deep knowledge about global health. I mean, we understand about making new vaccines and making them cheap. And so it's a very powerful combination. You can see that in the Beginnings Fund, getting the money out to help those mothers. We go in together to the countries and come up with the best plan for that country. Likewise with polio, where we're getting great support even in a tough place like Afghanistan and Pakistan, which are the only two countries that we've never gotten rid of polio. And so we're both bringing a lot of strengths and a common goal of ending these childhood deaths.
The last disease to be fully eradicated was smallpox. Will polio get eradicated within the 20-year timeframe you've given your foundation?
Yeah, absolutely. I admit I'm a little biased because I put many billions of dollars into this through the Gates Foundation. But we're, as we like to say, we're that close on it. Afghanistan and Pakistan have been much tougher than we expected. Afghanistan doesn't allow the house-to-house vaccination that makes it easy to get the 90% coverage you need. But we're getting a lot of support on that. So I'm very hopeful we'll bring it to an end there. And then we have some cases back in Africa. We did get Africa to zero. Unfortunately, up in the Lake Chad region, Niger, it spread quite a bit. But those numbers are starting to come down. So we have two fronts that we're fighting on. And our commitment is we're doing everything we can, and we'll make this the second human disease ever to be eradicated.
For somebody hearing you speak about the importance of eradicating polio, if they're in a developed country like the UAE or the US or the UK, why should they care? Why should they say, well, it's a few countries quite far away? Why does it matter?
Well, we're all humans, and every religion has the equivalent of the golden rule that we should treat other people generously, and particularly those like myself or the UAE who've had very good fortune and are very well off. Some portion should go to help those in need. Many of these are Muslim countries where the desire to have the solidarity is very strong. Things like the Lives and Livelihood Fund that's targeted to the poor Muslim countries, that's been very effective at helping to uplift those countries. And so, I'd say the moral case is very strong, but it's also that uncontrolled migration, civil unrest, where you're going to get wars if you can't take care of these kids and give them a a healthy life. We want well-off, stable countries that we can trade with, that we end these wars. The tragedy is that if a country is poor enough, the chance that you end up with like the civil war we had in Ethiopia, the awful war in Sudan right now, Gaza, of course, is very tough. And so when you lift countries up, the chance of that type of violence goes down, and we create a situation that every child deserves to live.
You've put a lot of focus on child health, and you mentioned both Sudan and Gaza, and there are many others, sadly, Yemen, Iraq, and Syria, especially during Daesh and so forth. So when you step back, you're doing a lot in public health, but politics gets in the way, and geopolitics, and you have an incredible voice. People listen to you. How much do you find that you are able to use your voice to try to calm down some of these conflicts, or do you try to stay away from it and say, let me focus on the public health side? Because they are so incredibly linked.
Yeah, our partners are more sophisticated about how the conflicts can end. We fund relief efforts in Gaza and Sudan. We want these wars to end. Our deep expertise is particularly in health. How do you stop a mother from bleeding to death? And we came up with this, incredibly easy to implement technique that's now being spread out. How do you have mothers be well nourished? And so usually what will happen is once a conflict ends and you're going in places like Gaza or Sudan, our partners who are politically very sophisticated will say, okay, now's the chance to go in, and we can help resuscitate the primary healthcare system, so that the children start to thrive there. And so we really do count on the key partners when it comes to the conflict negotiation piece.
Education and trust are essential, especially in some of the innovations, importantly vaccines, in order to get people to not only accept, but advocate for them. And yet we live in such a concerning time of misinformation, fake news, polarized politics. And again, you are a tech pioneer and you've thought about these issues. How can we rebuild trust, and how do you deal with a misinformed society when it comes to some of these issues?
Well, the misinformation about vaccines, strangely, in a rich country where the disease isn't there all the time, like measles or pertussis, you can be very lax and lower your vaccination rate, and you won't immediately get many deaths. I mean, take measles in particular. If you're in a country where the kids are well nourished and you have a good healthcare system, only about 4 out of 1,000 children die. Mm-hmm. In Africa, in the poor countries, about 250 out of 1,000 will die because they're just that much weaker and the care is not available. And so I hate to say this, but if anybody stops doing measles vaccination in the poor countries, immediately you see, and a measles death is a very characteristic, very particularly evil way that the child suffers. And so that tends to get people to say, wait a minute, this was a huge mistake. So it's only in the rich countries where you can let that rate drop down, and then the effect that children are at risk, that's really quite delayed. And so we don't see the same problems with believing in vaccines, but it's a constant battle to say, okay, who do these people trust? In Nigeria, some fantastic work was done with the Muslim leaders, where they would personally vaccinate their children, and people would say, okay, these vaccines are safe. Even the polio vaccine, there were rumors that meant we had a period around 2003 where there was a lot of vaccine refusal, but we overcame that with this great partnership with the Sultan of Sokoto and the Emir of Kano and a variety of incredible religious leaders.
So role modeling is key to try to bridge some of that.
Yeah, who do they trust?
Right.
And that was very successful.
I have to ask you a couple of more questions, even though our time is running out. First is just a moment on technology, and technology in terms of, you've spoken about AI, the impact it will have on creative industry and so forth, but you're also ever the optimistic about it. How do you see AI changing our societies, especially when it comes to helping the most in need?
Well, the Gates Foundation has as one of its big goals to make sure that the benefits of AI are available in the poor countries at the same time that it's rolling out in the rich countries. And you can think of that as three scenarios. Everybody should have a great virtual doctor that they can talk to lifelong, remember all their issues and help them out. Most people in Africa never meet a full doctor. You'll have a virtual tutor to help their education. And for the farmer, and this is another partnership we have with UAE, the understanding about the weather and what crop variety you should plant and crop disease and fertilizer and the price, when you should sell. We want the poorest farmer in their native language through their cell phone to have better advice than even the richest farmer has today. And so that idea of taking AI, using it to discover new tools like better seeds, better livestock genetics, but then also having it be part of that delivery that just the cell phone lets you ask about health and know where to go if you need care. That's an exciting vision. And there are AI leaders like Sheikh Tanoon who are very bought into that vision and are going to help us make sure that these poor countries benefit at the same time.
Finally, you said you've turned 70. Congratulations. And most people will be thinking, what's my retirement like? But you said you want to put in full energy for the future. What do you want your legacy to be when you think about legacy? It's too soon, too early, but when you think about legacy, what do you think it will be?
Well, I turned 70 this year and committed 100% of my remaining wealth to be spent through the foundation. So it has a 20-year lifetime. And we have very ambitious goals. First, to get polio done, but then malaria is another disease that should be eradicated. We can get the childhood death back on the decline instead of this short-term reversal that we faced. It'd be wonderful if 30 years from now, people said, malaria, what was that? Polio, what was that? In rich countries, when you say, TB, people don't have much awareness of it because we have done a good job, but it's still there in the poor countries. So, it's not that important that I be remembered. It's that we get rid of these things so we don't have to deal with them ever again.
And it's great to have you during the F1, and also we have goalkeepers. So what's your interest? What gets you interested in F1? What brings you here during F1 weekend?
Well, I'm sure it'll be fun. I've never been to an F1 event. They told me to bring earplugs. I don't know. So I'll also get to hang out, with the top people from the country that I've gotten to know and share notes with them. And, I think it'll be super fun to be part of what is an amazing event.
Thank you for your time.
Thank you.